Now let's have an introduction to the undergraduate training in clinical obstetrics. So just want to talk around, let me see, as an undergraduate now, we'll talk about this issue so that as an undergraduate, you know what you are expecting. Okay? So undergraduate training in clinical obstetrics. So for what we have here is this. Of course, obstetrics, you know that what you are dealing with women, but a special type of women. Okay, that's women that are pregnant. It's gynecology that deals with all types of women. All right. So undergraduate training in clinical obstetrics is actually a vital part of medical examination and medical education, rather. So it gives a basic medical student the basic knowledge, skills, and attitude necessary for you to be able to attend to a pregnant person. Do you understand? I'm saying basic because this is undergraduate. If you want to now specialize in obstetrics, you have to go for the postgraduate school. Do you understand? So for the core objectives, why they actually introduce this undergraduate training is because they want the person to understand the basic normal and abnormal pregnancy physiologies. They want the person to develop clinical skills in antenatal care and labor management and postpartum care. They want the person to recognize an obstetric emergency. They want the person to communicate effectively with patients. Do you understand? So, in medical school, they post you all around all departments so that in each department, there's a way you approach patients. The way I'm approaching an orthopedic patient will be different from the way I'm approaching an obstetric patient. Do you understand? So it will help you practice ethically and compassionately in sensitive reproductive health contexts. Okay? So key learning components: as an undergraduate, you have lectures and seminars to attend. Alright, you'll be doing clinical rotations where they'll post you in antenatal ward, neonatal intensive care units, special baby care units, all those units. Okay, in obstetrics, they'll rotate you all around. So skill labs and simulations, and case-based learning where they try to relate you to real life scenarios. Then assessment where later on they'll give you an examination. Okay, so institutions like Abafamili Awolowo University emphasize student-centered curriculum aligned with national and global standard, training in evidence-based clinical practice, development of therapeutic relationships and communication skills, and use of simulation and also community-based learning. Simulations is you use fake humans, okay, made with rubber. Then the community-based learning, they can post you to the hospital ward in real time where you get to communicate with patients real time, right? So over time it gives you that confidence. Okay.